Hi, I am Dr. Pritam Kalaskar. I am a medical oncologist at Mumbai Oncocare Center, Thane. I have been practicing cancer treatment or a cancer specialist since 2013. Today, we will be talking something very interesting about myths of cancer and chemotherapy. Myths are something which all the patients who come to us come with. These arise when the diagnosis happens. I'll just put some of those before you. First one is, whenever there is a cancer diagnosis, first question is, why me? Why did it happen to me? Then comes is, did I was eating something wrong? Then comes, I never consumed smoke or consumed alcohol. I am a pure vegetarian. I have never even touched onion. Or I have been a healthy, fitness freak guy whole my life. Then still, why me? These are the common questions which come to us with most of the patients. So I'll take one by one few of these answers. First of all, there is no reason why it happens to somebody. There is no specific reason why it happens to somebody. Apart from smoking and alcohol, we are yet to find a causative agent. Does diet causes cancer? No. Diet doesn't causes cancer. Only red meat is something which has been related to causative agent as cancer, that too in a Western diet. Apart from that, diet doesn't causes cancer. Yes, but a diet which is rich in junk food and causes obesity, makes your BMI more than 30 and 35, can be a reason for malignancy or cancer. So, diet per se, if you are keeping your BMI less than 25, will not cause cancer. Does lack of physical activity causes cancer? I would say not directly, but if you are not physically active and your BMI again is going beyond 25, then there is a risk of cancer. So a good healthy diet, less in junk, and a good lifestyle with exercise, maintaining your BMI less than 25, these are the answers to most of this question. Sometimes when somebody is absolutely fit, then what can be the reason? He's having a good diet, a fitness freak, still getting malignancy. Then in these cases, genetic changes can be a cause. Out of all the cancers, 10% of the cancers are genetically related. That can be reason in 10% of the patients. Last question which comes to most of the patient is, I had no symptoms. It was not there. I just examined it 1 month back. It was not there. How it come and it has now stage 4? How can that happen? So when I explain to my patients, I tell them, cancer is not something which has come from outside. Cancer is just a modification of your own cells. But for cancer, it's part of your own cells. Suppose it's lung cancer. The cells are same, but only body has lost control over those. And that is the reason we are not able to identify growth of cancerous cell in our body unless and until it reaches to a certain height where it will cause symptoms. Next part, we will be discussing something about myths of treatment of cancer. When we understand that the cancer has no reason to occur and it has already occurred, then comes the treatment of cancer. In treatment, there is a common myth. If cancer is there, nothing can be done. Whatever treatment you do, it is all going to get wasted. So it's not like that. Cancer is a curative disease if we identify the cancer at a certain stage. Like stage 1 to 3 of most of the cancers are curative. Patients can be cured in stage 1 to 3. If we are able to diagnose patients at these stages, they can be cured. When it goes to stage 4, there is a point where you cannot cure the patient, where you try to control and give them a good life. But when we talk about treatment of cancer, a lot of questions. There are a lot of questions because there is a lot of fear. And the fear are in form of this, like when you talk about chemotherapy, this chemotherapy is going to be very difficult for me. It is going to be painful. It will generate a lot of heat. I will lose all my hair. It will make me bedridden. I would not be able to work. I will not be able to eat. I will have a lot of nausea. These are some of the commonest myths, I would say, about chemotherapy. I would not deny that there is hair loss, but apart from there, other side effects are not very common. Most of the side effects are psychological, 50% are because of the drug. Nowadays, if the treatment is as per the weight and height of the patient, 90% of the patient will not have major side effects. They would have side effects only up to first 7 days, that to bit of nausea and vomiting. Beyond that, I have not seen much of side effects. Yes, in 10% of patients, you can have severe side effects. So, chemotherapy doesn't generate any heat. This is the first myth. It is not painful. When it is given, there is no pain. You can come and see the patients while taking chemotherapy, they are comfortable watching movies or doing their work. It is not something which is going to cause a lot of nausea and vomiting. I have patients, and all of us who doctors who treat cancers, they have patients who go to work also, who are working from home, who are going to their offices, taking all the necessary precaution on chemotherapy. So apart from this, is chemotherapy going to make me bedridden? Absolutely not. People can play, people can go out, people can jog, they can very well go for a movie, they can very well go for a play, but there are specific set of precautions that you have to follow. Like always wear a mask. If you are going for a movie, enter when everybody has entered and take a seat which is far away from people, if visible. If you are going for a play, then you have to practice a similar thing. Commonest marriages or a wedding ceremony, there what you can do is definitely suggested not to go when everybody is around. You can attend a marriage, just go at the beginning, meet the desired people, come back. Then comes, do I need to stay indoors? So very common thing. You don't require isolation. Cancer patients can very well have a routine life only and only if any of the family member is having cough or fever. That is the point where they should wear a mask. Otherwise, they don't even require a mask while staying home. So, no isolation, no separate room, no air condition is required. They can stay as everybody else is staying. So, it is absolutely safe to keep kids around grandparents or an elderly lady or anybody, even a mother who has a child of 1 year old. If she is on chemotherapy, child can remain with the mother. Chemotherapy doesn't affect people around. It doesn't affect the clothes or the bed sheets we used. They don't require a separate toilet. So kids and family members can safely stay with the cancer patients. So before we close, I just like to conclude. Today's world, cancer is not a death sentence to anybody. Let's not fear and stay out of the treatment. My best wishes to all the patients. Thank you.